We're live. 305 954. All right. Let's pull up our game. Hey y'all, hey. What's up? What's up? What's up? All right. Welcome. You guys are about to play NCLEX Jeopardy with me. All right, so for those of you that are new, welcome. For those of you that are returning, welcome back. Y'all know who it is. It is your girl, Nurse Sam. All right, I am going to be your host of NCLEX Jeopardy today. All right, as I am every Thursday at 7 p.m. Eastern Standard Time. Right here. Okay, this is our fun, motivational, creative way of studying NCLEX, studying for NCLEX, whether it's NCLEX RN or NCLEX PN. This is just our fun way of studying for it in a way that's not overwhelming and daunting and boring. Okay, thank you guys so much for coming and playing. Hello. All right, so quick house rules. So, like I said, this is NCLEX Jeopardy, and what I mean by that is we are basically playing a Jeopardy game, okay, with NCLEX categories and NCLEX style questions, okay? So, what I'm going to do is I'm going to read the question, I'm going to read the answer choices. You guys have to answer in the comments right here. You have to actually say what is, because it is Jeopardy, okay? So it's going to be multiple choice. The answers are going to be 1, 2, 3, or 4. So you got to pick an answer, whatever answer is correct that you think is correct, and then put what is 1, 2, 3, or 4. Okay, and the first person on my screen that answers correctly, and like I said, answers first and answers correctly, is going to be the winner of those points. Okay, we are playing for prizes. All right, y'all know I love a good incentive, so we are playing for prizes. Person with the person with the highest points is going to win a free digital study bundle. For all of you that already don't know, all right, today is the last day of our extended flash sale. I recently hit 70,000 Instagram followers, so thank you guys so much, all 70-something thousand of you. Thank you guys so much. So to celebrate, I did 70% off all digital study kits and bundles on thenursesam.com, so you can check that out. If you are studying for your NCLEX, I highly recommend the Ultimate Nursing School Bundle. It is, like I said, it's digital but printable. It's 400 pages, and it's going to cover your fundamentals, maternity, pharmacology, basically everything that we're about to play, all the categories in which we're about to play NCLEX Jeopardy, plus more. All right. There's more information on the actual site for what's actually included in those 400 pages and what topics are included, so make sure you check that out. Normally it's $97, but because it's 70% off, as I celebrate 70,000 IG followers, you just have to use code APP70, so APP70 at checkout, and instead of $97, that's going to run you less than 30. I think like 29 or 27, one of those. Okay, cannot beat that with a stick. You better save your 70% and get what you can now, okay? All right, so like I was, wait, hold on, is this what we're gonna do? Wait for it. Okay, so if you guys have any questions regarding the house rules, just let me know. Just type it right here in the comments. Either I'll answer it or a veteran will answer. This is, like I said, this is NCLEX Jeopardy for LPN and RN, okay? Everything that we are covering here, and majority of the NCLEX between RN and PN and LPN is going to be very similar, okay? There may be some like leadership changes, but this content is going to be learned and used both on the LPN NCLEX and the RN, okay? Maternity is going to be maternity, whether you're LPN or RN. You feel what I'm saying? So, absolutely. Let me look and see what you guys are saying. Hello. Awesome. All right, so let's go ahead and get into our NCLEX Jeopardy for, wait, not this one, for this week. All right, so we're going to have 5 categories per usual. All right, the ones that we're going to cover today: pharmacology, pediatrics, pharmacology, pediatrics, mental health, fundamentals, and adult health / med-surg. Okay, those are going to be our topics. We're going to have 5 questions per category, ranging from 100 points all the way to 500 points. And like I said, I'm going to read the question, the answer choices, and you guys are going to answer as fast as you can to the best of your ability with saying what is. Okay? All right. So let's look and see what are. Let's go ahead and start with let's go with, wait for it, pediatrics for 400. All right, that's going to be our first topic, first category, and our first question. Pediatrics for 400 points. Remember, in order to get these points, you have to get the answer correct and say what is, and also be first on my screen. Okay, if you're having some kind of lagging issue with the live, then X out and then come back in. Okay, all right. The mother of a 4-year-old child tells the pediatric nurse that the child's abdomen seems to be swollen. During further assessment, the mother tells the nurse that the child is eating well and that the activity level of the child is unchanged. The nurse, suspecting the possibility of Wilms tumor, should avoid which during the physical assessment? 1. Palpating the abdomen for a mass. 2. Assessing the urine for presence of hematuria. 3. Monitoring the temperature for presence of fever. Or 4. Monitoring the blood pressure for the presence of hypertension. All right. The nurse suspects the possibility of Wilms tumor. So he or she should avoid which during the physical assessment? 1. Palpating the abdomen for a mass. 2. Assessing the urine for the presence of hematuria. 3. Monitoring the temperature for the presence of fever. Or 4. Monitoring the blood pressure for presence of hypertension. It looks like all of us, we're all saying 1. We're either all right or all wrong, but we in this together. But our answer is, we all right. Okay, the answer is, what is 1? Palpating the abdomen for a mass. The nurse should avoid palpating the abdomen for a mass. All right, rationale says, Wilms tumor is the most common intra-abdominal and kidney tumor of childhood. If Wilms tumor is suspected, the tumor mass should not be palpated by the nurse. Why? Excessive manipulation can cause seeding of the tumor, and it will actually spread the cancer cells. Okay? Hematuria, fever, and hypertension, those are clinical manifestations associated with Wilms tumor. But the answer to this question is, what is 1? Palpating the abdomen for a mass. There is no palpating. There is no palpating of the abdomen when you suspect Wilms tumor. Okay? Great job. We 100%. Everybody got that one. So great job. First person, though, to get that, what on my screen was Singh Avtar. You said, what is A? A1. I know what you meant. But great job, Singh. You are now on the scoreboard with 400 points. All right. 400 points for you. Great job. Who else got it? Like I said, everybody got it. So Cows, Miss Fluffy Creations, Queen L, Lauren, Mary, Islander, E Blessed, Fit Nurse Mom Babe, Sandy, Maronda, I Princess Brianna, Gapster, E Pretty Classy, 2B21, Covered Tash, Miss Core, Dyra, Ola Delatonia. Great job. Awesome, guys. That was a good one. Okay, now next category, next question. Let's do farm. Let's do pharmacology. Let's do pharmacology. Cool. All right. Okay. This is farm for 200. Frequencies work those are different from my screen. Really? That's crazy. I didn't see yours, future ER. Man, okay, so if your thing isn't coming out, either just wait for this next time or log out. Not log out, but like exit out and then come back in. All right, so farm for 200. A client with hypertension has begun taking spironolactone. The nurse teaches the client to limit intake of which food? 1, rice. 2, salad. 3, oatmeal. Or 4, citrus fruits. We have a client with hypertension. They began taking spironolactone. The nurse teaches the client to limit intake of which food? 1, rice. 2, salad. 3, oatmeal. Or 4, citrus fruits. Remember to put what is. This is NCLEX Jeopardy. We got to stay on theme. Okay? What is our answer? I see 4s. I see 2s. I see oatmeal. I'm seeing majority 4s though. Let's look and see what that answer is. What is our answer? Answer is what is 4. What is 4? Which is citrus fruits. All right, the nurse is going to teach the client to limit intake of citrus fruits. There we go. All right, who's the first person to get that? We're going to go over the rationale, but I have a couple more questions to ask y'all too. So hold on 1 second. Let me see who got it first. Wait for it. Who said what is 4? Lanice, you said 4, but you didn't say what is. Remember, you have to say what is in order to qualify for the points. But you did get it right. So on NCLEX, you would have got it right. So at least take that away. Oh, Sing Avatar. Okay, Sing Avatar. You was already on the scoreboard with 400. So you just got another 200. So your score is now 600. Great job. Victoriously Vina got it. Sue. I am her. Eat blessed. Cows. Lauren. Dyra. Miranda. Uniquely. 2321, E Pretty Classy, Chriselle, Shay, Covered, Gabster, Alexis, awesome job. Oh, P.T. Hova. Okay. Hold on. We're gonna go over it. All right. You were first on my screen, boo. Remember, it's my screen. All right, guys, this is the rationale. Spironolactone is a potassium-retaining diuretic. Okay? It causes hyperkalemia. Because it retains the potassium, it causes hyperkalemia, or more than normal potassium in the blood, as a principal side effect or adverse effect. Why you not popping up? I wonder if it's a bunch of people that's doing it at the same time. I wonder. But yeah, no, I didn't see you guys's. Clients are instructed to restrict their intake of potassium-rich foods, such as citrus fruits and bananas. All right, the other foods on the list are appropriate for this diet. That's a log out and come back. Okay, yeah. Log out of the live and then come back in. But list another type of potassium-rich food. All right. So if citrus fruits wasn't on there, and they said, or bananas or something like that, and they put another fruit or food type that is rich in potassium, give me another Give me another type of potassium-rich food. Give me another type of potassium-rich food. Spinach, cantaloupe, ooh, avocado. Okay now. Sweet potato. As somebody said, is there a way to purchase this? These are free when we're doing it live. If you want to see the past replays, you would have to be a member of the study bar community. Okay? You have to be a member of the study bar community. You can just buy your membership. It's a monthly membership for nursing students. We recently reduced the price from $29.99 to $14.99. So it's now $14.99 a month. So if you want to watch more than 20 of these NCLEX Jeopardies, then you should sign up and join and become a member of Study Bar Community. Link in bio or studybarcommunity.com. Okay? Molasses, tomatoes, greens, green leafy vegetables. Great job, guys. Y'all had me on the potassium rich foods. That means y'all must be, did y'all have y'all nurse eats out? Did y'all have y'all nurse eats out? Period. All right, great job, guys. All right. We're about to do our next question. Okay? Let's do let's do fundamentals for 400. Fundamentals for 400 points. All right. A man has been admitted to the surgical unit after hernia repair surgery. The medical record reports that the client is human immunodeficiency virus positive, HIV positive. The nurse should implement which precautions for this client? The nurse should implement which precautions for this HIV positive client? 1. Contact precautions. 2. Droplet. 3. Airborne. Or 4. Standard. What precautions need to be implemented for this HIV positive client? Is it 1. Contact. 2. Droplet. 3. Airborne. Or 4. Standard? HIV positive client. Man has been admitted to the surgical unit after hernia repair surgery. All right, it reports that the client is HIV positive. The nurse should implement which precautions for this client? 1. Contact. 2. Droplet. 3. Airborne. Or 4. Standard. All right, so our answer is, what is 4 standard precautions? Standard precautions. A lot of people chose 1, which was contact, but it's actually 4 standard precautions. First person to correctly answer that on my screen was Queen L. Queen L, great job. Whoop. Whoop. You are now on the scoreboard with 400 points. Great job, love. Who else got what is 4? Anna Mac, Liz, Nay. Great job. And Tan, I see you. Tan So Glassy. Great job. All right, so it says having an HIV positive status does not warrant a special type of precaution. Instead, the nurse will implement standard precautions. Contact, droplet, and airborne precautions are implemented with specific types of infections or diseases, but are not necessary for clients who are HIV positive unless some additional specific infection is present. Okay? Dang, why am I not seeing y'all stuff? I wonder. It's so crazy. But if you did get 4, whether or not I saw it or not, great job. Awesome. That means you know it. But that's annoying that I can't see some of y'all answers. I wonder why. I'm going to Google it in a second. Okay. Next question. Med surge for 500. This is med surge for 500. They're post up threw me off since there could possibly be blood anywhere. I just came back up when it works. Oh, I see that, future ER nurse. Hey y'all, hey. Pure Bia, I see you. Kimmy K. I see. Oh, okay. Kimmy K said the fact that they were post-op threw me off since there could possibly be blood anywhere. Awesome job. All right, this one is adult health for 500 or med surg for 500. The nurse is the nurse is developing a teaching plan for a client with glaucoma. Which instructions should the nurse include in the plan of care? 1. Avoid overuse of the eyes. 2. Decrease the amount of salt in the diet. 3. Eye medications will need to be administered for life. Or 4. Decrease fluid intake to control the intraocular pressure. The nurse is developing a teaching plan for a client with glaucoma. Which instruction should the nurse include in the plan of care? 1. Avoid overuse of the eyes. 2. Decrease the amount of salt in the diet. 3. Eye medications will need to be administered for life. Or 4. Decrease fluid intake to control the intraocular pressure. What is our answer? What is our answer? All right, our answer is, I'm getting a sprinkle of everything. I'm getting 2s, 3s, 4s. Which one is it? And then I got a 1 right here. All right, what is going to be our answer for this teaching plan for a client with glaucoma? The answer is, what is 3? Eye medications will need to be administered for life. It says the administration of eye drops is a critical component of the treatment plan for the client with glaucoma. The client needs to be instructed that medications will need to be taken for the rest of his or her life. 1, 2, and 4 are not accurate instructions. So yeah, 3, those eye medications will need to be taken for the rest of life. First person that got that, I do, future ER nurse, I saw your answer. Emily Booth, I saw your answer. First person to get it right was T. Jacobs Taylor. Awesome job. T. Jacobs S. Taylor, maybe. Taylor, you are on the scoreboard with 500 points. Great job. Who all got what is 3? Anna Mack, Jasmine Green, Covered Tash, Tansel Glossy, Mika Morton. Yeah, future ER nurse, I saw your answer. Kelly Joe, great job, guys. All right. We did farm, peds, fundamentals, adult health. Now we have mental health. Ooh, this is a good one because I don't know this one. Ebony Gibbons, I can see that. I see that. All right, let's test it out. Mental health for 400. The nurse reviewing a client's diagnostic results recognizes that which is a possible positive indication for a diagnosis of schizophrenia. All right, which is a possible positive indication for a diagnosis of schizophrenia. 1, abnormally high blood flow to the frontal lobes. 2, atrophy of both the limbic structures and cerebellum. 3, abnormally small fissures on the surface of the brain. Or 4, atrophy of the lateral and or third ventricles of the brain. Which one is a possible positive indication for a diagnosis of schizophrenia? 1, abnormally high blood flow to the frontal lobes. 2, atrophy of both the limbic structures and cerebellum. 3, abnormally small fissures on the surface of the brain. Or 4, atrophy of the lateral and or third ventricles of the brain. What is our answer? What is our answer? All right, the correct answer is, what is 4? Atrophy of the lateral and or third ventricles of the brain. First person to get that one correct was Ebony Givens. Great job, Ebony Givens. And you just said, do you see my answer? And you have the correct one. Awesome job. Ebony.Givens, great job. You are on the scoreboard with 400 points. Great job, future ER nurse. Great job, Bentakib. Great job, Sangeeta. Lauren said, yeah, I never heard this one. Silly. All right. Yeah, I would have got that wrong. Me, Nurse Sam, personally, I would have got that wrong. So don't feel bad. That's literally why we're practicing. All right. This is just rehearsal. Think of this as like NCLEX rehearsal. Yeah, you can get it wrong with me. That's fine. As long as when you do get it wrong and we go through the rationales and detailed explanations and stuff, you take that with you so that during your real NCLEX, when you're actually taking it, you'll be like, if I wasn't for NCLEX Jeopardy, I would not have figured this out. I would not have known this. So shout out to Sam. So next time I'm asked about diagnosis of schizophrenia and a positive or possible positive indication, I'll know that it has something to do with the lateral and or third ventricles of the brain. Because let me tell you something. I did not know what this answer was at all. So great job. Great job. It says, well, it basically says imaging studies of the brains of individuals with confirmed diagnosis of schizophrenia have shown the consistent atrophy. You guys know what atrophy means, right? That means like the breakdown. All right. It means like the decrease in size, basically. So it's saying that it's the, it shows atrophy or decrease in size of the lateral and or third ventricles of the brain. Okay, the remaining options are not consistent with brain structure of individuals with schizo. Okay. That is future ER nurse. That is a good that's a good observation. 1 and 3 both had like abnormally, well, actually 1 said abnormally high blood flow. 3 said abnormally small fissures. 2 said atrophy of the limbic structures and cerebellum, and then 4 was atrophy of the lateral or third ventricles. So there was some like similarities and opposite like wording for some of them, but the answer is definitely 4. Light skin reaction. I did not see it. I did not see it. Did you answer correctly? Great job. Let's go with, let's start over and do farm. Let's start over and do farm. Actually, yeah, no. Let's take that back. 2 seconds. 2 seconds. Okay. I'm going to do these questions. Let's get into... This is, I guess, med-surg. I guess you want to say that? But let's do a specific topic for these next couple questions. We're going to do a specific topic. And it's going to go hand in hand with this freebie that I'm going to have and put up try to put up tonight. All right, the endocrine system. We're going to have some questions about the endocrine system. Okay? Hold on one second. Right. Great job. Okay. Let's do endocrine for 300. Let's do that. The nurse is caring for a client with pheochromocytoma. Pheochromocytoma. The client is scheduled for an adrenalectomy. During the preoperative period, the priority nursing action should be to monitor which criterion? 1. Vital signs. 2. Intake and output. 3. Urine for glucose and acetone. Or 4. The BUN level or the blood urea nitrogen level. We're caring for a client with pheochromocytoma. The client is scheduled for an adrenalectomy, so removal of the adrenal gland. During the preoperative period, the priority nursing action should be to monitor which criterion? So 1, vital signs. 2, intake and output. 3, urine for glucose and acetone. Or 4, blood urea nitrogen level or the BUN level. What is our answer? What is our answer? Pheochromocytoma. During pre-op. All right, this is pre-op. All right, the answer is, what is 1? What is 1 vital signs? What is 1 vital signs? Okay, I'm going to scroll back up to see who got that. But quick question again for 100 points. What is the hallmark sign of pheochromocytoma? Why is the answer vital signs? It's vital signs because what is the hallmark sign or manifestation of pheochromocytosis? What? Pheochromocytoma. Listen, Bentakib did not come to play with y'all. Or Golden Bronze Girl, period. Who else got it? Who else coming? Ash the one. BP Ash, but is it high or low? Future ER nurse coming to me with the high BP, period. Gapster, there we go. Awesome. Hypertension is the hallmark, not the channel hallmark. All right, it's the hallmark manifestation or symptom of pheochromocytosis. Why do you keep saying that? Pheochromocytoma. Okay, so obviously to be able to detect hypertension or high blood pressure, you would have to take the vital signs. Therefore, the answer is what is 1 vital signs. First person to, who did I say got that one? First person, Bentakib. Ooh, Bentakib, I'm gonna go ahead and give you your 100 points, and then I'm gonna scroll up to see who got what is 1 first. That was Queen L. Wait. Oh, Queen L, you're already on my scoreboard. So you just got another 300 points added. So Queen L, you now have 700 points. Great job. And then Bentakib got it first for the second question. Awesome job. Now, severe hypertension. Why is that bad? It can precipitate a stroke or sudden blindness. All right. Super high blood pressure is just not, it's just not good. Okay. Although all the other options are accurate, remember, it said the priority. Y'all, I know y'all hate that word, but unless it's coming with priority shipping, priority access. But when it comes to nursing, the priority nursing action, it should be to monitor the vital signs so you can catch that high BP, all right? Particularly the blood pressure, like I said. But so you can catch that, you have to monitor the vital signs. That's priority, all right? Great job. Second question. Pheochromocytoma. Where's my thing? Actually, let me look it up right here. 1 second. Oh, absolutely. Let's go here. Wait for it. Wait for it. Let's go right here. Okay, here we go. Pheochromocytoma. What is that? That is, wait for it. Well, I feel like it literally said it. I don't know, whatever. Pheochromocytoma is the hypersecretion of what? Do you know? Oh, I'm gonna be so impressed if you know this. Pheochromocytoma is the hypersecretion of what hormone? And where does it come from? The second part might be too much, but just give me number one. Just give me the first one. Hypersecretion of what? Do you know which hormone? Don't go Google it either. Ooh, y'all finna Google it too. Just messy. Well, that's fine. Hell, it's practice. But what is hypersecretion? Pheochromocytoma. It's hypersecretion of what hormone? Wait. Oh, I'm so ashamed. I wasn't even scrolled all the way down in the comments, and I'm just over here talking shit. My bad. Wait for it. All right, so it is actually, well, somebody said it actually. Who said it first? Bentakib, adrenaline or epinephrine. Adrenaline and noradrenaline, or epinephrine and norepinephrine. Okay? Will Carroll got it. And it does come from the adrenal gland. Awesome job. Great job. Yes. So pheochromocytoma is a hypersecretion of adrenaline. So just imagine if you have adrenaline pumping through your veins all the time. All the time. That blood pressure is going to be sky high. Okay? Great job. Great job. All right, let's go ahead and we're going to stick with the endocrine real quick. This one's for 400. After several diagnostic tests, a client is diagnosed with diabetes insipidus, or DI. The nurse understands that which signs/symptoms are indicative of this disorder. 1, blurred vision and hot, dry skin. 2, excessive thirst and urine output. 3, diarrhea and decreased urine output. Or 4, weight gain and increased urine-specific gravity. All right, we have a client that's just been diagnosed with diabetes insipidus. The nurse understands that which signs and symptoms are indicative of this disorder. 1, blurred vision and hot, dry skin. 2, excessive thirst and urine output. 3, diarrhea and decreased urine output. Or 4, weight gain and increased urine-specific gravity. What is our answer? Okay, Kelly Jo, you better come through with she's giving you treatment. She's giving you treatment options. All right, let's scroll up and see what our answer is. And that's funny because you're actually the first person to get it correct. But the answer is, what is 2, excessive thirst and urine output? All right, Kelly Jo got that first on my screen. Great job, Kelly, with like 5 Ys. 1, 2, 3, 4 underscore Joe. Great job. You are on the scoreboard with 400 points. Who else got that? Jasmine Green, Victoriously Vina, Feature ER Nurse, Pure Buyout, Ashla One, Benta Kib, Mary, Miss Bossy, Blackberry, Sangita. Kelly Jo came through and let you know the med for the treatment for DI. Hanif's, great job. Alexis, awesome job. All right, so once again, the answer is 2, excessive thirst and urine output. What's another name for excessive thirst? It starts with a P, and it's also one of the symptoms of pretty much all the diabetes. Diabetes insipidus, diabetes mellitus, type 1 and type 2. Excessive thirst, another name for it that starts with a P. Well, actually, yeah, polydipsia, absolutely. And then the excessive urine output, that also starts with a P. And the other, and it's also a part of the P collection. Excessive urine output starts with the P. Which one is that one? Polydipsia is excessive thirst, so excessive urine output should be polyuria, absolutely. It's funny how this one's diabetes insipidus and not like the diabetes that everyone's just so, familiar with, type 1 and type 2. And, they have their 3 Ps, excessive thirst, hunger, and urine output. And even with diabetes insipidus, it's still excessive thirst and excessive urine output. Let that be, take note. Stick that right there, okay? Save it for another time. All right, so those are classic symptoms of diabetes insipidus. All right, now let's take this a step further, okay? If we have excessive thirst, all right, and excessive urine output, obviously I can see that if we're drinking a lot, then I can only imagine that we're peeing a lot and we're urinating out a lot. So, question. If we're urinating, if we're drinking tons of water and urinating out frequently, do you expect for your urine to be diluted or concentrated? Do you expect for your urine, the urine of a patient with diabetes insipidus, do you expect for that urine to be diluted or concentrated? Okay, Smiles and Sing and Ash the One and Kelly Joe, diluted. Okay, absolutely diluted. All right, so when we have urine that's diluted, we can expect for it to be a nice pale color, a nice pale yellow color instead of like super concentrated. If you dehydrate it, it's like this. It is this yellow. But if you are very well hydrated, sometimes a little too hydrated, they aren't retaining fluids. Absolutely, Amaya. It's going to be diluted. So if we have diluted urine, is our urine specific gravity going to be high or low? Okay, Mary. I didn't even ask the question yet, Mary. But actually, that's incorrect. The urine specific gravity, that going to be low or high? I just pretty much said that that's going to be, yours is incorrect. It's actually going to be low. Thank you, Sing. Thank you, Sing. But I appreciate you, Mary, for coming in with such authority. All right, you was almost there, but yes, it's going to be the urine specific gravity is going to be low. Okay. Great job. All right, so kind of think of that in relation to concentration. The concentration of the particles in the urine, that's going to be low. That's why it's so diluted. Okay, there's more water than particles and things inside the actual solution or the urine. So that's going to be low in compared to the high amount of fluid. That's basically how you can think of specific gravity. All right, that's in relation to, I guess, the dilutants. All right, it's going to be low in relation to the high amount of fluid. Okay, you know how I think about it? If you just like when you're making Kool-Aid, all right, think of the actual powder in relation to the amount of water. All right, if you really want it sweet, 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 not too much water, Just go ahead and so you get that nice red color. But if you want it, you know, to the point where you don't get instant diabetes from the Kool-Aid. Oh, you see what I did there? Oh, funny. You're going to use plenty water. It's not going to be as sweet. All right? Low specific gravity of the Kool-Aid. All right? Anorexia and weight loss are going to occur with people with DI or diabetes insipidus. You know how I also think about it and how I remember for DI or diabetes insipidus, like I said, it's DI. When you think of diluted, DI, diabetes insipidus, you can think about it like that. So you can remember, okay, is the urine going to be concentrated or diluted? All right. Okay, great. Awesome job. You see how we just took that steps and steps further? That's how the NCLEX is going to do, y'all, honestly. So I just want to make sure that you're able to take it from one station to the next, It's called critical thinking, okay? Practice is the best thing for learning how to strengthen your critical thinking. All right, next question. This one's for 500 points. Thanks, Kelly. This one's for 500 points. A client has been diagnosed with hypoparathyroidism. Hypoparathyroidism. Which food groups should be included in the diet? 1. High in phosphorus and low in calcium. 2. Low in phosphorus and low in calcium. 3. Low in phosphorus and high in calcium. Or 4. High in phosphorus and high in calcium. Which food groups are going to be included in the diet of a client diagnosed with hypoparathyroidism? All right, I'm seeing lots of threes. I see a 4. I'm seeing majority threes, though. I see another 4. I'm going to read it again. 1, high in phosphorus and low in calcium. 2, low in phosphorus and low in calcium. 3, low in phosphorus and high in calcium. Or 4, high in phosphorus and high in calcium. What is our answer? What is our answer going to be? Kelly said, I know high calcium, but not sure about the phosphorus part. After we go over this, you will. You're going to leave here tonight not confused by that ever again. All right, so what is our answer? Let's scroll back up. And the answer is, what is 3, low in phosphorus and high in calcium? All right, seeing Avatar is the first person on my scoreboard to get that. You're already on the scoreboard with 600 points. You just got another 500. Great job. So now you have 1,100 points. Great job, seeing Avatar. Blackberry got it. Queen L, great job. Just Shauna, Mentoria J, hey boo hey. Lights, wait, no, you said 4, but that's okay. Ash the 1, great job. Liz, hey Adrena, Alexis, Immaculate Michelle, Pure Buyout, Binta Kib, great job. Awesome job. All right, now let's go ahead and take it step by step, just like we did last time, okay? Now, hypoparathyroidism. All right, hypo, you already know, let the words kind of help you. Hypo means below, less than, and then we have parathyroidism. All right, so obviously it is the undersecretion of parathyroid hormone. All right, parathyroid hormone, which comes from the parathyroid gland. Okay. If you have hypoparathyroidism, are you going to have low calcium or high calcium in your body? If you have hypoparathyroidism, are you going to have low calcium or high calcium? Thank you, Benta Kib. You're going to have low calcium. I see you, Jashana. Awesome job. All right, so hypo, think of low. Y'all see that? That was cute. Hypo, think of low. Drop it to the flow. Somebody sign me. You know what? Somebody sign me, please, because bars, period. All right, so when you think of hypo, think of low, dropping it to the flow. Whatever you want to think about, so you can get it in your mind. Sure. Why is that not? Oh. Sorry, I had to plug my computer back up. All right, so yes, hypo, think about low. All right, so parathyroid hormone, it actually affects two electrolytes. All right. It's going to affect the calcium, or be affected by the calcium and phosphorus. All right. So what you should remember is that the calcium and the phosphorus, they have an inverse relationship. All right. They have an inverse relationship. All right. When one goes low, one goes high. You can think they have a very petty relationship. Okay. One goes low, next one go high. All right. And then when one is high, the next one's low. So they have an inverse relationship. Think of it as like a seesaw. Okay, when one kid's on the flow, the next kid's high, and that's how that works. So calcium and phosphorus, in regards to the parathyroid gland, they have a seesaw/inverse relationship. Okay, so take it a step back. If we just said that hypoparathyroidism results in low calcium, which is hypocalcemia, if it results in low calcium, then we can expect that in relation to phosphorus, it's going to be high phosphorus, correct? Low calcium, think of the inverse for phosphorus. High potassium, low calcium, high phosphorus, okay? If we have that already present in the body, if we already have low calcium, aka high hypocalcemia, then we can expect that we are telling them to eat foods or have a diet that is rich in calcium, correct? If I have a low amount of calcium in my body, then I need to be eating foods with high amounts of calcium. All right, so in number 3, it said low in phosphorus and high in calcium. Okay? Honestly, because of the inverse relationship, as long as you get one of them, you can get the other one by just putting the inverse to it. If I know I have a diet high in calcium, then I must need a diet that's low in phosphorus. Because in my body, if my calcium is low, then in my body, the phosphorus is going to be high. Does that make sense? So I'm going to need a diet that corrects and balances out that deficiency. Does that make sense? Okay. Awesome. Great. I gave y'all points, right? Okay, perfect. All right. Last one. Kind of. I'm lying. The nursing instructor, I can speak. The nursing instructor asks a student to describe the pathophysiology that occurs in Cushing Syndrome. Which statement by the student indicates an accurate understanding of this disorder? 1. Cushing Syndrome is characterized by an oversecretion of insulin. 2. Cushing Syndrome is characterized by an oversecretion of glucocorticoid hormones. 3. Cushing Syndrome is characterized by an undersecretion of corticotropic hormones. Or 4. Cushing Syndrome is characterized by an undersecretion of glucocorticoid hormones. All right, which statement indicates an accurate understanding of this disorder? All right, I'm getting lots of 2s. Lots of 2s. Lots of twos. All right, let's see what our answer is. Someone said, I feel like I'm losing because my connection's slow. It's okay. I'm working on a way where we can, where we're going to actually do it in like a Zoom type environment. All right, so our answer is, what is 5? I'm kidding. What is 2? What is 2? Let me stop playing with y'all for y'all jump me. What is 2? Cushing syndrome is characterized by an over-secretion of glucocorticoid hormones. Wait, where'd it go? Glucocorticoid hormones. Wait for it. Wait for it. Okay, there we go. Had to open that up really quick. So yes, what is 2? It's an over-secretion of glucocorticoid hormones. Now, wait, let me look and see who got that. A lot of y'all got that one, so great job. First person to get, you know what? I don't know what kind of internet Sing has. But they got the internet. Great job, Sing. You are first to answer that correctly. So you just got 200 points added. So now you have 1,300 points. Okay? Like I said, we are playing for points just to make it fun, to make it exciting. But the whole purpose of us doing NCLEX Jeopardy is to A, have fun with it so it's not as scary and overwhelming. And then B, so you guys can actually learn and have a good review that actually retains and sticks in your memory. Okay? So if you're not answering first, it's perfectly fine as long as you're answering and getting it correct. Whether I see it or not, you know that means you comprehend that content. So don't beat yourself up if this game isn't, you're not getting first place. It's okay. Because on the NCLEX, you're winning, period. Okay, you're going to get that pass in 2 days. So you're going to panic for the first 2. But you're going to get that pass, period. All right, so Sing got it first. Mary also got it. Jules, Gapster, Sangeeta, Ash the One, Bentakib, Hey Adana, Anna Mac, Light Scam, Sylvia, Immaculate Michelle. Great job. And Gapster said too much steroid. Definitely. Awesome job. So, let me go into, because it's going to bother me. 1 second. All right. Now let's get into the specifics. Now we said, what we got? Cushing syndrome. All right. It is the oversecretion, once again, of glucocorticoid hormone. Specifically, cortisol. Damn, I should have asked y'all that. Ooh, that makes me mad. Okay, my bad. Hold on 1 second. Hold on. Damn, I should have asked y'all that. Ooh, I'm so mad. Okay, yes. So fine, yes. It's the oversecretion of glucocorticoids, in particular cortisol. So another name for Cushing's is hypercortisolism. Okay, it's too much of that cortisol. And that comes from, do y'all know where that comes from? Not the actually what is the target organ in Cushing syndrome? Is that what I want to say? I don't know if I'm saying that right. Let me see if one of y'all get it, to see if I'm saying that right. The target organ. What part? Okay, Smiles. Yes, the adrenal gland, but specifically what part? There's 2 parts. What specifically? Almost bent. Almost. Think of it. Cortisol is going to come from what part of the adrenal? Cortisol. It's going to come from where? What part? Cortex, absolutely. Cortisol comes from the cortex. Let that help you. Core, C-O-R, for the cortisol, or C-O-R-T for the cortisol, it's going to be from the cortex. Okay? Okie dokie. Y'all will see in the little freebie that I'm about to put up for y'all. Y'all will see which ones come from the cortex and which ones come from the medulla. Actually, remember our first question about endocrine, we were talking about the pheochromocytoma. That's actually from the adrenal medulla. Okay? But yeah, cortisol, cortex. Let that help you. Okay? What's going to be my other question? Cushing syndrome. Okay. So if Cushing syndrome is the oversecretion of that glucocorticoid hormone, aka cortisol, which disorder or disease is going to be characterized by an undersecretion of cortisol? Cushing's, we have an oversecretion of cortisol. So what is going to be the result of an undersecretion? Addison's disease. Absolutely. Addison's disease. Y'all know what I think about when I think about Addison's disease? And I'm not saying she had Addison's disease, but Addison Montgomery from Grey's Anatomy, okay? I just put them hand in hand. A, because some of the signs and symptoms of someone with Addison's, they're super skinny, okay? My dog Addison was like a size 0. She was skinty, all right? And that bronze pigmentation. And I don't know if y'all watched the show. I might be making this up. But she was just really bronzed. She had like a contour. I be making that up. And she had red hair. So that's what I think about with Addison's. Okay, it's an undersecretion of cortex, of cortisol. Okay. Which one has hyponatremia? Addison's, I believe. Where's my Ultimate Nursing School bundle? Yeah, Addison's. So I remember that with the, like I said, hypo, low to the flow. So when I think of what has hypo, then what is low? So Addison's is hypocortisolism. So hyponatremia, that's how I remember it. Wait for it. Where's my thing? Let me go back. Okay. Everything low in Addison's except potassium. There you go. Everything Ari. Boom. All right. Last one. And then this one is actually select all that apply. Select all that apply. The nurse educator is asking the nursing student, did I give points? I did. The nurse educator is asking the nursing student to recall the signs and symptoms of hypothyroidism. The nurse educator determines that the student understands this disorder if which are included in the student's response. Select all that apply. Y'all know how NCLEX is now. You got to get them all right or it's all wrong. All right. So there's 6 answer choices. This is select all that apply. We're ending it off with select all that apply. All right. We're looking for the signs and symptoms of hypothyroidism. 1, dry skin. 2, irritability. 3, palpitations. What? 4, weight loss. 5, constipation. Or 6, cold intolerance. we're looking for the signs and symptoms of hypothyroidism. Select all that apply. Is it 1, dry skin, 2, irritability, 3, palpitations, 4, weight loss, 5, constipation, or 6, cold intolerance? What is our answer? Hypothyroidism. Select all that apply. Select all that apply. Hypothyroidism. All right, and the answer is, or the answers are, whatever. Remember, you have to get all of them correct in order for you to get this answer correct. The answer is, what is 1, 5, and 6? Queen L is the first person to get it on my screen. Great job, Queen L. You just got 500 points added. So that just brought you to 1,200. So Sing Avatar, you're at 1,300, and Queen L, you are at 1,200. That was a close freaking game. We're going to go over it. Who else got it? Key Canis. Wait, where'd you go? Great job. 15615. Pure Buyout. Hey, Adana. Great job. Everybody that said 156. Now, I saw some where people were saying, somebody said 3, which is palpitations, irritability. Let's go through all of them. All right, so signs of hypothyroidism. Like I said, let the name help you. When I think it's also in the Ultimate Nursing School bundle. But for hypothyroidism, it's going to be dry skin, hair and loss of body hair, constipation, cold intolerance, lethargy and fatigue, weakness, muscle aches, paresthesia, which is like pins and needles, like the numbness, weight gain. How I remember hypothyroidism. For hypo, the letter O, I just think about the client. This might be mean, but it's visually. Hypo for obese. That's what I think about. They may not be obese, but O for obese, or the way they shaped, like a O and round, whatever. So weight gain for hypothyroidism. Bradycardia, generalized puffiness and edema around the face and eyes, forgetfulness, menstrual disturbances, cardiac enlargement, and a goiter. Okay, those are going to be your signs of hypothyroidism. Okay, the opposite, hyperthyroidism, that's going to be irritability, palpitations, and weight loss. Okay, so when I think about hyper, I think about someone that is hyper. If you have a kid or just someone in general that's hyper and moving about all over, do you expect for them to be overweight or skinny? Skinny. They're gonna lose that weight because they're always on the go. They're hyper. Okay, so think about a high metabolism. Thank you. Yes, Ashley, one. Slow versus high metabolism. Think about that. Okay, so with hyperthyroidism, everything is high. Just like with hypo, everything is pretty much low or slow. Okay, hypo, low and slow. Hyper, I don't have a rhyming word with it. Hyper sniper, I'm just kidding. But yes, weight loss because they're hyper and just everything's kind of at high metabolism. Palpitations and irritability. Hearts beating fast because they're moving fast. And then irritability, I just think of they get irritated fast. That's how I just put that's how I put it two and two together for me personally. But yes, those are going to be your signs and symptoms for both hypothyroidism, O, low and slow, And then hyper sniper for hyperthyroidism. That was a good point, Ash, the one. Think of slow versus high metabolism. Okay. Siobhan said I get a thyroidectomy next month. Oh, wow. Do you have? I mean, you don't have to tell your business right here. But I wish you a very, very safe and successful surgery. Definitely. All right, guys. So that ends our game. The winner of tonight's points is going to be Sing Avatar with 1,300 points. Congratulations, Sing. No, I gained a lot of weight from it. Really? Do you have anything that's like in addition to the hyper? Or is there like a reason, like why? And like, is your appetite decreased, increased, anything like that? That's interesting to know. But yes, great job, Sing Avatar. Woo! You won first place with 1,300 points. Queen L, you got 1,200 points. You also did amazing. All right, you were right on the cusp. But yes, Sing Avatar, are you still here? And Queen L, are you still here? Let me know if you are still in the building. Sing Avatar or Queen L, are y'all still in the building? Comment, let me know so I can tell you what to do to get your prize. Who's still here? Thank you. I haven't seen Sing. Where is he or she? I'm not sure. All right, Queen L, if you do not have the Ultimate Nursing School bundle, DM me your first name and last, or your full name and your full email address, so I can go ahead and send that to you, because congratulations, you won a free Ultimate Nursing School bundle. Great job. Awesome job, everybody. Thank you so much for playing NCLEX Jeopardy with me. Thank you so much for playing. Just let me confirm that you heard me, Queen L, that you need to send me your name and email address to get your prize. If you already have the Ultimate Nursing School bundle, let me know if you don't have the NCLEX Arcade. Because if you have the Ultimate Nursing School bundle, then you win the NCLEX Arcade. Let me know if you have it, one or the other. Okay. Okay, perfect. Thank you guys so much for playing NCLEX Jeopardy with me. Was it helpful? Did you learn a lot today? Did you learn a lot? I wanted to ask some of those endocrine questions because I just wanted to see, and I want you guys to see how comfortable you are with endo disorders, hormones, all that stuff, because NCLEX loves it. They love it. They love a good, ooh, what's the sign and symptom of whatever disease? They love it. Okay, awesome. Kikana said yes, she has enjoyed it. Thank you so much for joining me. So we do this every Thursday at 7 p.m. So we go over some of the questions, some of the weekly questions on live verbally, but so you guys can have time to yourself to study for yourself. Make sure you download the NurseSam app, which is back up, thank God, which is back up. Download the NurseSam app. It's free, so you can play the mobile version of NCLEX Jeopardy. So we only did a couple questions. I forgot how many questions we did. 1, 2, 3. Whatever. We didn't do 25 though. So to play the full 25 questions in all those categories, make sure you download the free NurseSam app and go to NCLEX Prep and then play NCLEX Jeopardy mobile. So you can see the screen, you can see the categories, the blue screen, press it, go through it, ask yourself the question, and then when you're ready to answer it, press the space bar, press whatever key to see the answer and the detailed rationale. All right. So once again, it's just a fun way to do our review, both joint together as a group, because I find it more fun that way. But just in case someone's like, okay, I need on-the-go studying, or I couldn't participate in the live, but I still want to do my practice, I still want to do my questions, make sure you download the free Nurse Sam app. It is in my bio. Link is in my bio for both iOS and Android. 100% free. It's called the Nurse Sam. All right, white background, literally says Nurse Sam in the little avatar. And then when you open that app, go to NCLEX Prep and then play NCLEX Jeopardy Mobile, all right, for your free 25 questions. Once again, if you want to rewatch this replay and all the other replays, so we have way over 20 replays of NCLEX Jeopardy where we're going over the questions as a group. If you want to watch those replays, make sure you sign up and become a member of the Study Bar community. We lowered the price. We're not $29.99 anymore. We are now $14.99 a month. You still get all the same amazingness and same awesomeness, but pretty much half the price. So $14.99 to become a monthly member of the Study Bar community, so you have access to all of these reviews, these video reviews and replays. Same thing with Tease Tuesday replays. And then you get, exclusive videos that we do every Sunday at 6 p.m. within the group where we're going over something. The endocrine worksheet that I'm talking about uploading, that's been in the Study Bar community for weeks. they get it first. So if it's like new stuff that we have, they get first access. So if you want to become a member, you can do that now. StudyBarCommunity.com. Subscribe for only $14.99 a month and get all your goodies. Okay. Thank you guys so much. Once again, join me next week, Thursday, for another session. And then I'm going to be doing a comprehensive NCLEX review outside of NCLEX Jeopardy. So be on the lookout for that. Make sure you are but make sure you're on my email list and or have the app so you can get the push notification of when that comprehensive NCLEX review is going to be. Alrighty? Alright, so thank you guys so much, and I will see y'all next time. Next Thursday, or if you come for teas, I'll see y'all Tuesday. Alright? Thanks.